right. Dr. Rafich here from Vet Triage. We are looking at JAVMA, January 1st, 2016, and this is the paper, Palliative Radiation Therapy for Solid Tumors in Dogs, 103 cases, 2007-2011. So 100 cases is pretty good, much more impressive than most papers that we review here. This study comes out of the University of Pennsylvania, the vet school. The objective is to evaluate the clinical response, adverse effects, outcomes associated with palliative radiation therapy in dogs with various solid tumor types of various body conditions. So now you can, of course, see some limitations of the paper already. It's retrospective, which means that it's going to have lack of standardization, and they're dealing with different solid tumor types of different parts of the body, so even further expansion on the problem that there's lack of standardization in this study. So immediately those 103 dogs, although a nice number to have, it now gets hindered by that variability. Procedures, results. So the cancers include carcinoma, sarcoma, melanoma, primary bone tumor, mast cell tumor, ameloblastoma. Overall tumor and clinical response, 75% and 77% respectively. The median survival time, 134 days. Dogs that had a positive response or maintained stable disease after palliative radiation therapy had a longer, significantly longer median survival time than dogs with progressive disease. Tumor location was not significantly associated with median progression-free survival time or median survival time. Most dogs tolerated it well. Acute and chronic effects were observed, but were self-limiting. Conclusions, beneficial response, and improvement in quality of life that positively was associated with survival time. Introduction. The goal of palliative radiation therapy is to improve the patient's quality of life by the alleviation of clinical signs such as those associated with pain, bleeding, obstruction, and differs from curative intent or definitive radiation therapy, where the goal is to destroy the malignancy and restore the patient to a disease-free state. Extending the survival time is a secondary effect and not the primary goal of palliative radiation therapy. Palliative therapy is indicated when a curative outcome like tumor eradication is not a reasonable expectation because the patient has metastatic disease or advanced local disease. Also, patients with comorbidities that preclude daily anesthesia or that limit life expectancy may influence the decision to pursue a palliative radiation therapy protocol. So the anesthesia comment here is because in animals, they can't sit still for radiation therapy. I don't know what they do in people. I assume that they're not anesthetized. But in animals, it's full anesthesia. And not every pet can handle that. Palliative radiation therapy consists of weekly administration of large doses of radiation. There are different variations, such as the quad shot, which is 2 fractions administered daily for 2 consecutive days, or a 5 daily dose protocol is also can be used. The design is to minimally These are designed to minimize the acute adverse effects of radiation therapy. Although palliative radiation therapy increases the risk for chronic adverse effects, the patients treated in this modality are typically not living long enough to get chronic effects. Osteosarcoma, nasal tumors, soft tissue sarcomas, melanoma, mast cell tumors have all been studied. For dogs with osteosarcoma that received palliative radiation therapy, where 16 to 32 gray was divided into 2 or 3 and 4 fractions. The median onset of clinical response was 11 to 21 days. The median duration of clinical response, 53 to 130 days. Overall response, 50% to 93%. For those with carcinoma, sarcoma, squamous cell carcinoma, lymphoma, mast cell tumor, melanoma, and neuroblastoma of nasal tumors treated with palliative radiation, with 16 to 40 gray divided into 2, 3, 4, and 5 fractions. The overall response, 57% to 100%. Median survival, 146 to 441 days. For dogs with soft tissue sarcoma, median survival, 332 days with 3 8 gray fractions and 309 days with 4 8 gray fractions. Non-resectable grade 1 to grade 3 mast cell tumors that were treated with prednisolone and palliative radiation with 4 8 gray fractions administered at 7-day intervals. The overall response rate was 88.6%, and the median progression-free survival time was 1,031 days. Okay, materials and methods. Dogs. These were dogs with advanced local disease, evidence of metastasis, or had comorbidities that precluded anesthesia, or had otherwise limited life expectancy. The palliative radiation therapy protocols. Radiation therapy was administered to all dogs with a 6 megavolt linear accelerator. For some dogs, CT was used for planning. Each dog received one of 3 protocols, either 8 gray fractions administered once a week for 4 weeks. So it's a 4/8 gray fraction protocol, or 6 gray fractions given once or twice a week for 6 weeks. So a 6 gray fraction protocol, or 3.5 gray fractions administered twice daily for 2 consecutive days, which is the quad shot. Toxicity criteria was established by the Veterinary Radiation Therapy Oncology Group, acute and chronic effects. Here they define these as within 1 month or over 3 months after completing the regimen. Tumor response was measured in 2 or 3 dimensions when possible and was either complete response, partial response, stable disease, or progressive disease. A clinical response defined as improvements in symptoms. A complete response is disappearance of all measurable tumors and clinical signs. Partial response was a decrease in tumor size of over 50% but less than 100%, and improvement but not resolution of symptoms. Stable disease is less than 50% decrease in tumor size or less than 25% increase in tumor volume with no improvement or worsening of symptoms. Progressive disease is over 25% increase in tumor size and worsening of tumor associated clinical signs, or failure to maintain a complete or partial response or stable disease for a minimum of 30 days. The overall response rate was calculated as the number of dogs that responded to palliative radiation therapy, meaning the number of dogs that were classified as having a complete response, partial response, or stable disease, divided by the number of dogs enrolled in the study. Survival time was considered a surrogate measure of quality of life because it's assumed that most dog owners chose to euthanize when quality of life deteriorated. Progression-free survival time was defined as the interval between the initiation of palliative radiation therapy and local tumor progression, metastasis, or death. Results. 58 mostly castrated males, median age 10 years, mostly mixed breeds, second Labradors, and then other dogs. Tumor types and location: nasal adenocarcinoma, transitional cell carcinoma, tonsillar squamous cell carcinoma, anal sac adenocarcinoma, hemangiosarcoma, hemangiopericytoma, primary bone tumors like osteosarcoma, mast cell tumors, and those are the more common ones, or many other tumors, and then mostly head, neck, or appendicular locations. Initial staging: metastatic disease, 36% of dogs before therapy. Some received oral analgesics, some received anti-inflammatories, some chemotherapy, some had surgery. 41% had recurrent or progressive disease after surgery or after chemotherapy, and 42% had advanced disease that was manifested as metastasis or aggressive infiltrative disease that was not amenable to surgery before radiation therapy. The idea here is to emphasize that these dogs, although there's a huge variety of dogs in this study, they all had advanced disease, poor prognosis, all that kind of thing. So they're treating the worst of the worst cases here. Palliative radiation therapy. Computerized treatment was used in 46% of dogs. 69% completed the planned radiation therapy protocol. Reasons for not completing it was anesthesia issues, comorbidity, tumor progression, adverse effects that affected quality of life, and achievement of a palliative response with fewer doses of radiation therapy than planned. 55% developed acute adverse effects, mostly dermatitis, alopecia, mucositis, but others. 55 to 60% had acute. Chronic disease or chronic adverse effects from radiation therapy, 12% of dogs, and there was a bunch of them. I'll list them out here. Neuropathy, blindness, laryngeal paralysis, dry mouth, leukotrichia, lymphedema, KCS, alopecia, hyperpigmentation, scar tissues. All of the dogs survived to at least 9 months following palliative radiation therapy, and most survived over 2 years. And those are dogs that just had the chronic adverse effects, right? So these are dogs that lived way beyond what they thought was possible. Most of the dogs did not. But the ones that developed chronic disease, they all survived at least 9 months, and some of them over 2 years. All right, clinical outcome. 3% had a complete response, 15% had a partial response, 57% had stable disease, 25% progressive disease, overall response rate 75%, overall clinical response rate 77%, and neither vary significantly among tumor types or tumor locations. Probably the result of just low numbers when you divide up by tumor location and types in the study. Following radiation therapy, metastatic disease was detected in the lymph nodes in 7%, lungs 15%, other sites 6%, 78% died because of tumor-related disease, 13% died from non-tumor related, 9% loss of follow-up. Median survival time 134 days. The median progression-free survival time was 106 days. The median survival time and median progression-free survival time did not differ significantly among tumor types. However, the median survival time of 89 days and the median progression-free survival time of 34 days for dogs with metastatic disease before therapy was significantly shorter than the median survival time of 184 days and the median progression-free survival time of 147 days for dogs without metastatic disease. And that's common sense, right? They have spread of cancer, they're not going to live as long or not respond as well. The median survival time for dogs that developed complete or partial resolution or partial response at 265 days and had stable disease 184 days after therapy were significantly longer than the median survival time of dogs with progressive disease, 25 days. And of course, that makes sense. With more advanced disease, or rather with a less optimal response rate, they're not going to survive as long. The difference between median survival time for dogs that develop a complete or partial response and the median survival time for dogs with stable disease did not quite reach significance. The median progression-free survival time was 216 days for dogs that developed a complete or partial response and 121 days for dogs with stable disease following radiation therapy. The median progression-free survival time did not differ significantly amongst tumor types. A significant positive association was noted between tumor response and improvement in patient symptoms. Chemotherapy, the presence of metastatic disease before radiation therapy, and other tumor types were also evaluated, and there was no significant interactions identified. Compared with dogs with progressive disease, the hazard for death was significantly lower for dogs that developed a complete or partial response or stable disease following partial radiation therapy. The median survival time and tumor response did not differ significantly between the 4-8 Gray fraction protocol and the 6 Gray fraction protocol. Similarly, the median free progression survival time did not differ significantly between the 4-8 Gray fraction protocol at 104 days and the 6 Gray fraction protocol of 110 days. Okay, now tumor-specific outcomes. Overall response rate 67% for dogs with nasal adenocarcinoma. Median survival time for these dogs was 265 days. For tonsillar squamous cell carcinoma, overall response 80%. Median survival time 127 days. Oral non-tonsillar squamous cell carcinoma. One dog survived 324 days. One survived 458 days. Dogs with anal sac adenocarcinoma. Median survival time 217 days. Urothelial transitional cell carcinoma. Median survival time 31 days. And then for oral malignant melanoma, median survival time 134 days. Mast cell tumor, median survival time 71 days. Of the 4 dogs with other types of solid tumors, 2 had acanthomatous ameloblastoma. 1 had tonsillar squamous cell carcinoma and sarcoma of the trunk. 1 had thyroid carcinoma and oral melanoma. So the 2 dogs with the ameloblastoma had progression-free survival times of 690 and 358 days, and survival times of 690 and 923 days. The median survival time was 195 days for the dogs with the other tumor types. All right, discussion. Results of the study suggest that the hypofractionated radiation therapy, so that's palliative radiation, is a viable treatment option for most types of solid tumors in dogs. Although the mean overall response rate was 75%, it varied amongst tumor types between 50 and 100%. 55% had adverse acute reactions. They were self-limiting and resolved with supportive care. Chronic adverse was 12% of dogs, and they survived 3 months or more. That's how they define chronic adverse reactions. The median progression-free survival time and the median survival time for dogs with soft tissue sarcoma that received palliative radiation therapy at a dose of 24 gray, meaning 3 8 gray fractions, or 32 gray, meaning 4 8 gray fractions, were longer than the median progression-free survival time and median survival time for similar dogs in the present study. In another study in which dogs with soft tissue sarcoma received palliative radiation therapy that consisted of the administration of 4 gray fraction daily for 5 consecutive days, the median progression-free survival time and the median survival time were 5.7 and 7.9 months respectively, values that were similar to dogs with soft tissue sarcoma in this study. The overall response rate to palliative radiation therapy was high at 87%. The majority of owners, 83%, reported improvement in their pet's appetite, energy, activity, and signs of pain. The median survival time was 217 days for the 3 dogs with anal sac adenocarcinoma that received a 6 gray fraction protocol, which was similar to the median survival time of 231 days for dogs with anal sac adenocarcinoma that received 4 gray fraction daily for 5 consecutive days. In 2 other studies in which dogs with tonsillar squamous cell carcinoma received various combinations of multimodal treatments, including surgery, chemo, and hypofractionated radiation therapy, the median survival time ranged from 179 to 211 days. In the present study, the median survival time was only 127 days for dogs with tonsillar squamous cell carcinoma. The 2 dogs with oral non-tonsillar squamous cell carcinoma in this study survived 324 and 458 days, which is similar to the median survival time of 15 to 16 months for dogs reported with oral non-tonsillar squamous cell carcinoma that received curative intent radiation therapy, total dose of 48 to 57 gray. In another study of 10 dogs with transitional cell carcinoma, median survival time was 326 days. In the dogs in this study with transitional cell carcinoma, they only survived 31 days. But again, these dogs had more advanced disease in this study. Palliative radiation therapy for the treatment of osteosarcoma, median survival times reported 122 to 313 days. In this study, the median progression-free survival time and median survival time for dogs with osteosarcoma or chondrosarcoma was 104 days. In other studies, the median survival time for dogs with osteosarcoma of the axial skeleton was similar to that of dogs with osteosarcoma of the appendicular skeleton following palliative radiation therapy. In this study, mast cell tumors had a very short median progression-free survival time of 31 days and a median survival time of 71 days. Those results were similar to that of another study with mast cell tumors that were treated with hypofractionated radiation therapy and either prednisone or chemotherapy. They had a median progression-free survival time of 61 days and a median survival time of 98 days. Dogs with mast cell tumors that were treated with hypofractionated radiotherapy and prednisolone had a median progression-free survival time of 1,031 days. Tumor grade is known to be negatively associated with survival. In another study of dogs with mast cell tumors that were treated with hypofractionated radiotherapy, tocurenib, and prednisone had a median progression-free survival time of 316 days. However, histologic evaluation to determine tumor grade was performed in only some of those dogs in that study. Local recurrence of mast cell tumor is also associated with a poor prognosis. Acanthomatous ameloblastoma, formerly known as Acanthomatous epulis, is a locally invasive benign odontogenic tumor, meaning coming from the dentition. The primary goal is local control because they don't spread. Median survival time 48 months for 57 dogs with acanthomatous ameloblastoma that were treated with curative intent radiotherapy. And they concluded in that study that radiotherapy was effective for those tumors. In this study, survival was 690 and 923 days with palliative radiation therapy. Finally, they mentioned that the quality of life is a subjective response, and instruments to measure quality of life have not been validated for use in veterinary patients, probably because that's common sense. Like sometimes these qualitative or quantitative measurements for things that are like sort of subjective, like quality of life, are pretty are not going to be most amenable to actual studies because it's such a complex topic. But there are certainly studies that have tried to quantify it by using like charts and measurements like that way. But it's kind of a silly thing. It should be sort of trusted that these pet owners know what quality of life is because it's subjective. Although they use survival time as a surrogate for measuring quality of life in this study, a positive association between survival time and quality of life has not been definitively established in dogs with cancer. So there you have it. I mean, for veterinarians, obviously, recognize that there are more and more treatments for animals with aggressive disease. So always give pet owners the option of seeing an oncologist before you can condemn them to being euthanized. And then for pet owners, again, despite what your veterinarian might say, they may not be aware that therapies like this might exist. And if you're a do-it-all kind of person, ask for a referral to an oncologist or Google one in your area and make an appointment yourself, have the records transferred over so you can at least get a second opinion for these cases. I'm not saying that you should have false hope with these advanced disease cases. I'm saying just to consult with the oncologist. They can give you all the options so you can decide on what you think is best for your pet in your scenario. Okay, we'll see you guys again tomorrow. Bye-bye.